Hello, you wonderful, amazing, imperfect human being, and welcome to episode 48 of the Stand Up with Pete Dominick podcast. Today's episode is not brought to you by any corporate sponsors yet. This podcast is supported by almost 350 paying subscribers. To find out how you can support the podcast, click the link in the show notes or go to PeteDominick.com. Welcome to the classroom of life that is Stand Up with Pete Dominick, where every episode I reach out to my extensive network of super smart, well-spoken, enlightening people to talk about the issues, problems, and struggles that we all deal with on our journey, both collectively and as individual members of the human family. Well, folks, currently you may or may not know, but we are my family that is in transition in my life and career. And I have been very transparent and honest about it. I'm not going to lie. It continues to be very challenging for me and for us, my wife and I specifically. I think we've been able to protect the girls from our deepest concerns and anxieties over money and the future, but it's hard day to day as I try to build something new to sustain and support my family financially. Since I started opening up about my challenges and struggles in an honest and emotional level, I've heard from so many of you who've shared your own issues and obstacles with me. I feel so lucky and rewarded, and I've been able to communicate and learn from so many of you. I've gained so much perspective on how hard things can be, and I'm determined to find solutions for all of it and for all of us. I don't know how, but I am trying my best every day. The scariest and most frustrating issue with my company SiriusXM not re-signing me is that my family has lost the great health insurance that came with working for a big corporation, a big media company. Now, my wife is a freelance personal trainer. She's a health coach, a yoga teacher, and she works her ass off almost every day visiting clients and teaching classes, and she's really stepped up in every imaginable and some actually I never imagined ways to do all she can to support me and our family, and I'm working harder than I've ever worked in my life. But none of what we're doing comes with a health insurance policy. So we have to pay for that on the exchanges. We live in New York State, and we have of course, exchanges here in our state that we've got to buy now our own insurance policy. And it is a huge burden for Americans like Val and I who are freelancers. Medical costs in this country are way out of control. I'm sure you know the current system, it's not sustainable. Anybody paying attention to it on either side or any side of the issue understands that. And almost every other country in the world gets better outcomes for half the price. The Canadians, the French, the Israelis, the British, German, and Italians, the Aussies, the Japanese, the Swiss, the Sri Lankans, the Saudis, the Norwegians, all of them. They all look at us and think we are nuts for having a massive for-profit health insurance industry. And they also pay less for the pharmaceutical drugs that we develop. And I've been talking about issues with experts for years, long before we found ourselves in this situation. I've been concerned about this for everybody else, knowing that at some point I could very well find myself here. And here we are. I've reached out to the best people to discuss our broken healthcare system over the years and created great relationships with them. And we will continue to discuss this throughout the presidential campaign and after, how we can work together, how we can organize, how we can demand a better, more fair, sustainable, equitable health insurance system, much less healthcare system. So today, I welcome one of the best people I've talked to on that issue, former health insurance industry insider, former corporate communications guy, Wendell Potter. Wendell has written a whole bunch of books about this. He worked in journalism and then in the private health insurance industry for years, made a lot of money, and then just found himself in a moral quandary when he realized how broken and unfair the system was. He blew the whistle. He talked to Bill Moyers. He talked to everybody, including myself. And he has been talking for years now about this. Follow him on Twitter at Wendell Potter. Get all of his great books. Check out his organization's website, MedicareForAllNow.org and BusinessForMedicareForAll.org. You'll note a little edit right here at the top. I wanted to just keep in the opening of the phone call, and I jump into the conversation with him. And then at some point, you'll hear a call waiting signal. That's my bad. I'm so sorry. I didn't want to edit it out because he was making a good point. but how unprofessional of me. Here now, my conversation with the brilliant, thoughtful, and filled with integrity Wendell Potter.
Potter.
Mr. Potter, Pete Dominic.
Pete, my goodness, it's you. How are you, my friend?
Long time since I've heard your thoughtful voice.
Well, it has been a while since we've talked. It's just great to hear your voice and to have a chance to talk again. How have you been?
Very excited to have Wendell Potter joining me for the first time on the podcast. I talked to him a number of times at SiriusXM, and I think he is a really great guy, heroic guy, a guy with a lot of integrity. Wendell Potter, thank you for being on the podcast. Appreciate you talking to me today.
Pete, it's wonderful. I appreciate the opportunity. Great to talk to you again.
Let's tell your story a little bit so people know kind of where you came from. You started out as a local journalist in the 70s, and then you went to D.C. and you covered Congress, and then you got into PR in healthcare. Is that how it worked?
That's right. I was a reporter in my home state of Tennessee. Worked all across the state. I worked in Memphis and Nashville, covered local politics and state politics, and you're right, I had a chance then to go on to Washington. I covered Congress and the White House for Scripps Howard newspapers back in the day. But I decided to actually get into PR through a political campaign. I moved back to Tennessee and worked for a Democrat who was running for governor at the time. He didn't win, but he asked me to stay on and work with him, and I did until I decided to get into the healthcare business. And altogether, I worked about 25 years in healthcare, starting at a big hospital system and then moving to Humana in Louisville and Cigna. And I altogether worked about 20 years for those companies. So I saw inside how these companies really operate, and finally got sick of it and realized that what I was doing for a living, Pete, was the exact opposite of what I tried to do as a reporter. I came to terms with the realization that I was misleading people purposely, and I had a hard time living with myself when I woke up to that reality.
You wrote a book about it. You've written 3 books now, a New York Times bestseller as well. And I remember as a member of the media just hearing you come out and basically be a whistleblower on the health insurance industry. And you made a huge splash. I mean, I think you were on Rachel Maddow and a whole bunch of shows, including mine, which I was really happy to have you and have you over the years over and over again. But I want to go back to that moment when you basically blew the whistle. What, after spending 25 years in the health insurance industry, you said you worked for Humana, you worked then at Cigna, you were the head of corporate communications. It was your job to drive a message. You had this crisis of conscience in 2008. Was it a gradual, slow build where you thought, oh, what I'm doing is not good, or was there this seminal event? Because I remember you talking about at least one experience that you had in helping, seeing people in rural areas not being able to access healthcare.
It was both, to be honest with you. I was beginning to be very concerned about the role that I was playing in perpetuating a very profitable industry. And but it took a seminal moment. It took a trip back home to Tennessee to visit family to really make me wake up. I had an epiphany. I never thought I would use a term like that to describe anything in my life, but I did. And I borrowed my dad's car. I'd read an article in the local paper about something called a healthcare expedition that was being held not too far from where I grew up, just across the state line in Wise County, Virginia. The paper said that this pop-up medical clinic that was being held in this little town in the middle of the Southern Appalachians, the people were expected to come from hundreds of miles away by the thousands to get care that doctors and nurses and dentists were providing free of charge over 3 days in late July. This was in 2007, and I went there out of curiosity. I was at the time working on what we referred to as a white paper to try to make people believe that the problem of the uninsured was not a big deal, that people who were uninsured were lazy, that they were just shirking their individual responsibility, and consequently it was their fault, not anybody else's, that we were getting close to 50 million people at that time who didn't have health insurance. I when I got to Wise County and I walked through the fairground gates, this was a county fairground where they have, county fairs. And so there are barns and animal stalls and all kinds of buildings like that on the site. I witnessed something that I never would have imagined seeing in this country when I got there. People were lined up by the hundreds in lines that stretched out of view. They were soaking wet because it had been raining, but they were not about to leave their place in line. And I saw that a lot of those lines led to barns and animal stalls that had been cleaned up as best they could be as examining rooms. It was just astonishing to me that this was happening just a few miles from where I grew up. And I realized at that moment that I had to accept some responsibility for that because of the work that I did, to mislead people about our healthcare system and to obscure the reality of what so many people had to go through and still have to go through, Pete. This thing continues. These free clinics all across the country, and if anything, they've gotten even more prevalent. And it's people now with insurance increasingly who are going to these events. I made a decision that day that I had to find some other way to earn a living. I ultimately did leave my job and decided that at least one thing I could do would be to help advocates understand how the health insurance industry really operates and how propaganda works. That was a big part of the reason that I stepped forward with testimony before the Senate committee in June of 2009.
Did you know when you were working PR, corporate communications, did you know that what you were saying was propaganda or wasn't accurate, or did you and others fool yourself into believing? I mean, that's what that job is, isn't it?
It is, and you fool yourself. I saw it happen. I've read and talked and now written how this happens to people, but you compartmentalize a lot of what you do when you're on the job, and you become part of a team. You want your team to win, so there's that mentality that sets in. You think that if you're providing something that is at least partially true, what's wrong with that? And then I realized, well, there's a lot wrong with that. If you are, even if you're not outright lying, if you're withholding key facts and figures, and frankly doing that to mislead people, then there's something very wrong with that. And I've called it a crisis of conscience. I probably wouldn't have had that had I not been a reporter and had I not grown up where I did, and to witness what I saw. I think that part of my background made a big difference in my decision to quit. But it really bothered me. I realized that if I hadn't been lucky, I grew up in a working class family, and my dad worked in a factory and didn't make a lot of money, but he and mom set aside a little bit of money every paycheck for years so that I could go to college. Neither of them had that chance. Nobody in my family had ever gone to college. So I felt that I was just fortunate to have been born to them and have the chances that I had to succeed. But if it hadn't been that way, I could have been one of those people in those long lines. And it just had a profound effect on me.
One of the phrases that we have all now heard, every American in every corner of this country has heard this phrase, pre-existing conditions. And I want to understand how you use that phrase or how you looked at that phrase when you were working inside the health insurance industry.
We tried to make people not really understand it or even be aware of it. When I was saying I was writing that white paper, one of the things that I was purposely trying to obscure was that my company and the industry broadly, as a common and prevalent practice, refused to sell coverage at any price to people, in many cases with a pre-existing condition. And if they were willing to sell them coverage, they were charging them far more than they would charge people who were healthier. They engaged in individual underwriting. They still do to a certain extent. But they used that information. When you apply for coverage, you are they ask you about your health, and if you admit to almost anything, they will use that back then to determine how much they would charge you, or if they would sell you coverage at all. That was a big reason I went to Washington as much as I did during the debate. I wanted to make sure that Congress was really aware of that and did something to protect people with pre-existing conditions. But in my work, we tried to obscure that. In that white paper I was writing, I would make no mention, of course, of the fact that a lot of people who were uninsured were not that way by choice, but because they had been blackballed by an insurance company. And once that happens one time, it's almost impossible to get coverage, or was back then, from any health insurance company.
It's like it's similar to having bad credit.
Exactly. It's exactly the same way. Other insurers know. They can find out. We have very little privacy as we are becoming increasingly aware.
Right.
And whenever we go to the doctor, whenever we get a prescription filled, whenever we go to the hospital, all that is part of our medical record, and insurance companies have access to it.
So a lot of people think that pre-existing conditions are also your fault. It's because you're lazy. You didn't take good care of yourself. That's been a fairly effective. I'm not sure that the health insurance industry sold it, but certainly a lot of politicians and a lot of folks in the media, and just anecdotally, people often look at it that way. Well, you shouldn't have gotten pregnant, or you should eat better, or you shouldn't have fallen off that curb and broken your leg. Is that a thing that do people fall off curbs and break legs? I can't believe I couldn't come up with a better accident example, but you know what I mean.
I know what you mean.
How do you address the argument that if you have a pre-existing condition, it's because you didn't take good care of yourself?
It's prevalent, particularly among conservatives and even moderates, and even liberals to a certain extent, that we have an individual responsibility. Others have written about the individual responsibility bandwagon that really took hold during the George W. Bush years, that it is our responsibility, not society's, and overlook the fact that the food industry, the beverage industry, the tobacco industry, all of them spend millions and billions of dollars trying to get us to eat crap and smoke and drink and not take care of ourselves, and then we'll say that, well, you're weak by falling for that or not taking care of yourself. It's an insidious belief among many, but the fact is that even if you try your best, if you eat right and never eat a Twinkie, at some point in your life, you're going to have a pre-existing condition. It's almost inevitable. So that just doesn't hold up.
It's going to be really awkward now that I have to do a live read from my big sponsor, Hostess Twinkies, but I'll wait till after we're done here. You've had a couple. I haven't had a Twinkie, I don't think, in 30 years, by the way. You've had a couple of really interesting, passionate Twitter threads recently. Follow Wendell on Twitter, at Wendell Potter. He's really good on Twitter. Very good, obviously, communicator. That's what he did at the insurance industry at the companies. But you wrote a couple days ago, you tweeted, "Lately, I've noticed some Democratic politicians defending the current healthcare system by saying it preserves, quote, choice for Americans. As a former health insurance executive who helped draft this talking point, I need to come clean on its backstory and why it's wrong and a trap." I was hoping that you could kind of recreate the rest of that tweet thread right here on the show.
Yeah, I did that so that people can understand how propaganda works and how the industry works in ways that are frankly Orwellian. The word choice and the word competition, they are often used together. Those are words that we learned, we being the industry, from focus groups and experts in linguistics, know that in America those words have resonance. People, we're Americans, so we think that choice is better than anything almost. And so insurance companies have used that purposely to make people think that they actually do have choice, and to obscure this. And what they obscure is that the choice that we really care about most is the ability to choose the doctors and hospitals that we want to see. We don't care so much about the choice of health insurance companies. But here's the other thing. They're also obscuring the fact that most of us don't have that choice to pick our health insurance companies. They make a big deal out of the fact that most Americans who get insurance through the private sector, if we're of working age, that we get it through our employer. But it is our employer that chooses which health insurance company we will have if we decide to get coverage at work. We don't have that choice. So that's why I said it's Orwellian. It's not true. They use that word to confuse us, and they've taken that word and run with it and to bamboozle us, and they've done a very, very good job of it. And I wrote that thread just to help people understand what's going on and even why some Democratic candidates are picking up on it. They see the same research. They know the word choice resonates. And so they, too, are guilty of misleading us by using that word the way they've been using it.
You have also launched like a nonprofit or a C4 about Medicare for All, supporting Medicare for All. Yeah. Tell me a little bit about the system that the solutions and the system that you see working to create more affordability, more access, and better quality health insurance, thus health care for all of us.
10 years ago, when we were debating what became the Affordable Care Act or Obamacare, I was supportive of a single-payer system, but it wasn't allowed to be talked about in Washington. The Obama administration and Democrats in Congress made sure of that. There were no hearings on what we called Medicare for All or single-payer health care. In fact, even advocates were thrown out of hearings if they were, making some noise about it.
Yeah, I remember that.
That literally happened. And so, I saw the power of the industry at work back then, and I thought, well, the industry is just too powerful. It's never going to happen. But in recent years, I've come around to seeing that Medicare for All is inevitable, and that the industry is going to lose this ultimately, because businesses in this country are realizing that they've been sold a bill of goods by the insurance industry over many years. Small businesses in particular are just not able to offer coverage anymore. And that's where jobs are really being created in this country. Mid-sized businesses are struggling. Large businesses are even realizing that big insurance companies can't control healthcare costs. So I've seen a big change among businesses. And one of the nonprofits that I've formed is called Business for Medicare for All. It's a 501c3 nonprofit. And we make the business and economic case for Medicare for All and explain to policymakers and the public and other business people that the current system does not work for businesses, and it's making our businesses increasingly non-competitive in the global marketplace. Other countries don't have a system that saddles businesses with this responsibility of offering coverage to their workers like the U.S. does. So it's not working there. The other nonprofit is called Medicare for All Now, and it's a 501c4. It enables us to do more work explaining and using tools and techniques to help people understand what it is we're talking about and why Medicare for All is the right policy for all of us as a country, individuals, families, communities, and businesses, and the country as a whole. We're not endorsing any candidates, but we exist to help communicate the benefits of Medicare for All and to push back against the propaganda from my old industry.
That, by the way, MedicareForAllNow.org. What's the best thing listeners, Americans can do to take action to support these efforts?
Well, sign on, first of all, to get information from us. We have a growing mailing list. I think we already reach about 80,000 people. We've only been around a few months, so we're getting a big list of supporters. Being a nonprofit, we need to have funding, and we're getting a lot of small dollar donations, which is extraordinarily, that's very encouraging. And it's just evidence that the public really supports this. So if they can go and check us out and have the ability to throw us a buck or two, we would certainly be grateful. it helps us to reach more people and do this important work.
Well, you just got one more email because I so rudely filled out the form at MedicareForAllNow.org while you were talking, Wendell.
Thank you. Thanks so much, Pete.
When you look at the rest of the world's health insurance systems, from Canada to the UK to Israel, France, Australia, Japan, wherever you want to look at, how do you compare them? Because it's really interesting to talk to people from those countries. I have regular conversations with folks in Australia and Canada, just friends of mine, and they are always flabbergasted by the situation that we have here, especially my personal situation after losing my job at SiriusXM, where I had a great insurance and now having to figure it out for my family on the individual market. When I tell my friends in other countries about that, they can't fathom the stress and the navigating all of the the hoops that you have to jump through to figure out the best healthcare system, much less the cost. How do you look at the rest of the world and how they look at us? What have you seen? What do you think that we could copy? Obviously, we're a different country than they are, but what works, what doesn't?
I've experienced the same thing, and I've spoken a lot in Canada and the UK and many other places to audiences about the U.S. healthcare system, and they just are baffled that we put up with this system, a system that, like you noted, you can lose your coverage when your job ends, or if you want to change jobs. In fact, we're hesitant in many cases to change jobs or start a business or become. We're locked into our jobs because of this crazy system, and that benefits employers. It's one of the ways that they can lock us in and keep us on the grind. Even if we hate our jobs, we're fearful of leaving it.
So true.
And other folks don't around the world. They cannot figure out why we put up with this, but they don't really fully understand the power of propaganda and how the industry has got us to believe things that aren't true. But what we need to do is look at the ways these other countries have gotten not only universal coverage, but they control healthcare costs in ways that we can't and that our system cannot because of the way it's structured. And we need to look to them for inspiration. And I think, frankly, the bills that are in Congress, in both the House and the Senate, Senator Sanders is the chief sponsor of the Medicare for All bill in the Senate, and Congresswoman Pramila Jayapal in the House, which, by the way, in the House version of the bill, more than half of the Democrats in Congress have signed on as co-sponsors. They have looked at other systems, and the Canadian system certainly is one that has been a model, because what we are proposing, what those bills would do, is create a publicly financed and privately delivered healthcare system, as they have in Canada. In the UK, it's more socialized, because most of the hospitals are owned by the National Health Service, which is part of the British government, and most of the doctors are employees of the NHS. So what we can learn, and we should be learning from the other countries around the world. But our opponents in this work, my old industry, have done a super job over many years of getting us to believe that other systems are inferior, that they ration care, that people have to wait on long lines. It's all malarkey, as Biden would say. Bullshit, if you want to go further. But that used to be what I used to get people to believe, and now I feel one of the reasons I'm doing this is because I feel a compelling need to make amends for all that I used to do. It's a long way of saying we need to learn from other countries. We don't necessarily need to import one system from another country to ours, and that's not what's being proposed. But we have the Medicare program, which has been around for more than 50 years. It works. People love it. It has its shortcomings. It needs to be improved. But we've got a system that works, and we can just expand that. And the transition to that, Pete, would be much simpler than the transition to the Obamacare exchanges, which was extraordinarily complex.
I got to let you go, but I know you're not endorsing a candidate, or at least you don't plan to. When we're talking a little bit about the insurance reforms that you do support, but you have been picking on Pete Buttigieg on Twitter. What's wrong? What's wrong with what he's proposing?
Well, regrettably, he's using a lot of the industry talking points, and the industry has to be delighted with what he's talking about. He, and not he alone, but he in particular, is really talking badly about Medicare for All and saying that let's set up a system of Medicare for those who want it. And it sounds just great on the surface, but the problem is as long as you leave the current system intact, the insurance industry will continue to control their healthcare system and be the gatekeepers to care. And they spend enormous amounts of money on marketing and advertising and lobbying and campaign contributions to protect their profits and their interest. That will continue. And if you just have a system like he espouses, the people who most need care, who are the poorest and the sickest, might gravitate toward a public option that he supports and that I once supported myself. But that will be just fine and dandy for the insurance industry. They will be able to cherry pick even more than they can now, those they want to insure. And insurance companies cannot control cost, and we will continue to have this other huge problem of ever-increasing healthcare costs that is affecting every one of us in this country, including those of us who have private insurance.
WendellPotter.com on Twitter, at Wendell Potter, at MFA_now, and check out the website and support that organization as well. Sir, it's great to catch up with you. MedicareForAllNow.org, that's what it is. Great to catch up with you. Thank you so much for your time today. I look forward to having you back on the podcast throughout the campaign, and whenever you're available. You are an authority on this stuff, and really just a great, great guy. I've loved getting to know you and reading your stuff over the years. Thanks for joining me.
Thank you so much, Pete. Thank you so much.
All right.
Take care.
All right, there you go. Wendell Potter. Look him up. Check the show notes for all the links to Wendell Potter's stuff. And that is all in terms of guests I've got for you today. No extras. It's President's Day on Monday. I don't know when you're listening to this. That's a weird thing about podcasts. You never know when people are listening to this. But if you've got opinions and arguments for what is broken about our health insurance industry, I'd love to hear from you. Email me or tweet me or Facebook me or whatever. And let me know what you think would go a long way to fixing our very broken and arguably extremely corrupt system. And the next episode of the podcast will be featuring opinions from political experts across the spectrum about who they think would be the best candidate for take on Donald Trump. Who would be the best nominee to take on Donald Trump? There's a lot of really strong opinions. I'll be getting a lot of them for you on the next podcast. So thank you very much for tuning in. And please support me with a paid subscription on Patreon, where over 330 people have invested in this podcast, where we'll get all of the best experts I can find and keep talking about these issues. Thank you for joining my community here on Stand Up. Let me know what we can do better. Also, I'm doing a live feed for all the Patreon supporters, a live broadcast on Wednesday night of this week. If you are, again, if you're listening, I don't know when you're listening, but it would be Wednesday the 19th at 9 p.m. Eastern, patreon.com/Pete Dominic, and join the live conversation with the whole community there. All right, that's it. We're out.